Any ideas?
I think you have to educate the patient about his or her condition. Then after that, you educate him or her the consequences of the danger smoking poses on his health.
Exactly. So the smoking, most of the people who smoke become very much addicted to it. So they develop some dependence in terms of nicotine. So as much as possible, you want to counsel them in terms of behavioral. So psychosocial and behavioral counseling is very, very key. So they have to know that the smoking is a major risk factor, and these are the consequences. If you don't stop smoking, the pain will continue, the condition will progress, and the complications will increase. And you have to counsel them appropriately because it's very, very difficult to stop. So, aside counseling, which is a non pharmacological way, if you are looking at pharmacological, because most of the non pharmacological may not work for smoking. So, you may need to add non-pharmacological ways of stopping smoking. So aside counseling, what again can help the patient in terms of pharmacological therapies?
Doc, please, we can have nicotine replacement therapy. I think there are some sprays that's or some patches and gums. Yes, the gums that people can take to gradually wean them off nicotine.
To a lot of harmful substances. So aside the nicotine, which is giving them that euphoria feeling, they may be inhaling nauseous gases as well and other harmful substances from the smoking. So in place of smoking, you want to devise other methods that can give them that similar euphoria feeling without exposing them to these harmful chemicals or substances. So this can come in the form of nicotine replacement therapies. So as you rightly said, there are nicotine products like gum, you have the inhaler, you have the patch, you have nicotine lozenges, you have nicotine spray. So all these are nicotine replacement therapies. So nicotine gum, nicotine lozenges, nicotine patch, nicotine inhalers, spray, all these are available. So in terms of pharmacological ways, you can use nicotine replacement therapies. Any other, aside nicotine replacement therapies, any other pharmacological ways? Any other drug you can use to stop smoking? So we have other drugs like bupropion. So bupropion is one of the antidepressants. So basically, it inhibits the reuptake of dopamine and noradrenaline in the brain. So if you have a lot of dopamine not available in the brain, it sort of increase the euphoria feeling. So the euphoria feeling you get from smoking is being replaced by bupropion that increases the level of dopamine in the brain to give you that euphoria feeling without exposing you to the nauseous substances that can harm you. So that can also be used. Aside bupropion, we also have another drug called varenicline. So varenicline. So varenicline acts as a partial agonist. So we have nicotine receptors in the body. So it's a partial agonist of the nicotine receptor. So it gives you some level of euphoria, not as much as the nicotine will give, but it prevents nicotine from binding to the nicotine receptors. So it rather binds to that, and it's a partial agonist, giving you some level of euphoria. So that can also be used. So depending on the patient you are dealing with, maybe for them, counseling was enough to stop the smoking. Others, counseling may not be enough. You may have to introduce these medical therapies. So either the nicotine replacement therapies, drugs like varenicline or bupropion. So that is how you can stop smoking. So you can either do non-pharmacological or pharmacological. Aside smoking cessation, what other non-pharmacological can you recommend? What other non-pharmacological?
Please, since uncontrolled hypertension is one of the risk factors, we can encourage them to engage in moderate exercise and also reduce the intake of fats.
Okay, all right. So hypertension is a risk factor for the atherosclerosis. So you can modify hypertension. And if you are looking at non-pharmacological ways of modifying hypertension, then we are looking at DASH diet. So have you heard of DASH diet? So we have something called the DASH diet. So dietary approach to stopping hypertension. So basically, in terms of diet, you want them to take in diets high in fruits and vegetables, low calories, low fat. So more of the fruits and vegetables. And in terms of salt intake, you want them to reduce salt intake in their diet. So that is basically the DASH diet. So we are looking at high levels of fruits, vegetables, reduce salt intake, reduce fat, and reduce caloric intakes. So that's how you modify hypertension. Then you also mentioned exercise. So usually you want them to engage in moderate exercise, and it has to be supervised because the symptoms associated with peripheral artery disease, we mentioned intermittent claudication. And intermittent claudication happens during exertion. So